The 340B program is one of the really unique programs in healthcare because it has no direct impact on cost to taxpayers, costs to the federal government, state governments, or to our patients. It's wonderful we're blessed in this country with publicly traded companies that we see in the stock market, and these publicly traded companies can give back to rural communities through the 340B program.
One of the big things that we are able to do with 340B dollars is to provide an infusion clinic where patients can get life-saving drugs close to home. We also really focus on providing health care in our rural health clinics to patients that may not otherwise have the transportation or the means to get other places.
The 340B programs really helped us meet underserved patients that didn't have access to health care, wouldn't have the means to travel long distances, and then really just wouldn't have gotten care. I think the 340B program in a lot of ways has helped save lives in Southeast Kansas.
Through the 340B program, our hospital is able to access high-cost medications that we may not be able to have access to without the 340B program.
It's allowed us to stretch our scarce federal resources and provide care to many, many more patients. My estimate would be it's a tenfold return for our patients.
We have a lot of very sick patients. Our hospital is able to bridge those gaps to people that wouldn't have care otherwise.
Without the 340B program, there's a potential that we could lose hospitals, clinics, services that are vitally important to the health and the welfare of not only our patients, but the economic viability of the state of Kansas.
The services that we are able to provide the patients that wouldn't have access to care is enormous. The patients are the reason why we do everything, and 340B just helps us to serve these patients.